Don't worry. Fantastic. Okay, we're live now.
Okay, great.
Yes, thank you for coming. I'm going to hand over to my colleagues, Steph and Sally, in just a moment. But for those of you watching, if you do have any questions during this webinar, there is a Q&A button at the top of your screen, so please do use that. But yes, now I'm going to hand over to my colleagues to begin the show.
I'm glad you call it a show.
Yep.
Good afternoon, everybody. Thanks for joining us today. We just wanted today to talk about the England's care workforce, and I'm absolutely delighted to say that we've got Sally Lloyd with us from Skills for Care. So Sally, would you like to introduce yourself and then just tell us maybe a little bit about what you do, and then we'll take it from there.
Yeah, hello Steph, and thanks for asking me along today to speak to everybody. So Sally Lloyd, I'm Programme Head at Skills for Care, and I oversee our work activity in relation to qualifications and standards for the adult social care workforce. That includes many different aspects, Steph, as you know, but clearly quals and standards are our key topic. So most of the work that we're currently working on at the moment for the workforce has been commissioned by the Department of Health and Social Care. But this year we've been working on some updates to the level 3 and 5 diploma qualifications, some ongoing work around the new level 2 adult social care certificate. And we're also currently looking at the level 4 diploma in adult care for the workforce as well. And with regards to standards, this year we're actually doing some work on reviewing and updating some core capability frameworks for the health and care sectors. And the topics that we're currently working on are dementia, mental health, end-of-life care and frailty. And as many of you know that will be listening, they are a basis really out there for types of non-accredited training delivered for the workforce, but also the smaller range of qualifications in those specialist topics that are available as well.
Brilliant, thanks for that. Well, we'll touch on those again a little bit later on, but we just wanted to set a little bit of context really and tell you a little bit about, I suppose, a little bit about where we are now. I think we're probably all aware that health and social care has been identified by the government in various strategy documents around skills and industrial strategy and targets for growth. So we're really seeing some of that, and working together with organisations like Skills for Care helps us as an awarding organisation really think about what we should be doing. So we're going to have a little look at the context that we're working in. Sally's going to talk a little bit more detail about what Skills for Care have been up to and the direction of travel, and then we'll touch upon what OCN London can offer and kind of what we're working on, and a little bit about partnership working. So hopefully there'll be something here to spark your interest. So a little bit of thinking about the context that we're in. I mean, I'm sure we're probably all aware that there's a huge amount of stats out there that say that the health and social care sector is under a lot of pressure for a variety of reasons. We are seeing, I suppose, I was listening to a program about demography actually this morning, and they were talking about the bulge of people who are now reaching the age of 65 and above, and there being an aging population because of that, and that driving demand for care services. Skills England, and we've seen them come into place this year, have suggested that there's above 430,000 posts going to be available by 2035 and 2.38 million in total by 2040. So there's real potential and real demand in this sector and a real need to build skills. When we look at that and what the kind of situation we're in now, again, Skills for Care have suggested that there's 1.7 million posts that are there, and that there is an 8.3% vacancy rate with 131,000 vacancies. And I suppose kind of sadly as well that we see a huge turnover of people within the sector as well, with a 26% turnover of staff overall and 45% for under 25. So that's a quite remarkable figure for people entering into the sector and then exiting. again. So you can see there's some clear identification that there's demand, but that you can see there is clear issues around the workforce and their skills and the turnover and fulfilling the vacancies. Now, if we just think a little bit about kind of the key aspects, and again, Sally's touched on this, and I think you can see some of the threads here around some of the work that Skills for Care are doing. Where are some of these key shortages particularly acute? Well, at the moment, we are seeing those in dementia and end-of-life care. We're seeing those in delegated healthcare tasks and particularly clinical skills. We're looking at a real demand for digital skills in the health and social care workforce too. And on top of that as well, real issues around the overall workforce ageing as well, with now nearly a third of the workforce aged 55 and above. So there are real challenges for this sector overall. So other bits and bobs that we should probably consider in terms of context here that's important. I think notoriously there are issues around pay and progression, with the median care wage at £11 an hour. That's a little bit of a dated stat, obviously, but you know, I think all of us would probably look at that and go, wow, £11 an hour for doing this kind of work. The average for roles was only £12.36 an hour in March 2024. And often there is only tiny reward for experience. You can be a very experienced care worker but not see a huge rise in your income for the skills and knowledge and experience that you have. Obviously, we've seen an increase in the living wage in 2024. So in theory, that should have some impact, but it's still only £13.15 in London. And then I know this is quite a complex area in terms of recruitment. And again, probably some quite well-rehearsed conversations about this sector and the way that the dynamics within the sector have shifted and changed, where we saw a significant number of overseas recruits coming in, 105,000 in 23-24. And then subsequent to that, we have seen visa rule changes where we're increasingly seeing the ability for people who come to work in the UK and England in particular to be able to not be able to bring their dependents with them, and also a CQC sponsor requirement. And part of that has seen the care worker visa grants falling by 84%. Now, I mean, there's a lot of talk about homegrown skills and knowledge and getting people into work, but that's quite a stark figure to look at when you look at the demand and the number of vacancies. Now, Skills England, who I'm sure, again, we're probably all aware, came into place earlier this year and are have started to publish a range of documentations and policies and positions and strategies, have identified that care is a national priority. The sector is overall. They've identified 36% of vacancies as skills shortages. And as we identified earlier, those range of areas around dementia, end of life, etc. And I think this is a really interesting point, is that in the work that they've already completed, they've really identified the demand for modular, RPL-based and ESOL integrated provision. And I think for us as an awarding organisation, that is absolutely a key thing that we need to consider. So other things that can happen that Skills England have identified, as Sally's touched on, there was the redevelopment of the Level 2 Adult Social Care Certificate, which was funded via the LDSS scheme, and I know Sally will talk a little bit about that too. And again, for us as an assessment organisation, the apprenticeships are often seen as too long and complex for many employers. But what is emerging is a more dynamic approach to skills and qualifications, with modular, flexible learning pathways emerging. So there is some hope here in amongst, some of these quite stark figures and information that we're looking at. Now, I'm going to hand over to Sally now just to talk about some of the initiatives and actions that they are taking at Skills for Care, set against some of these kind of the context in which they are working. So Sally, I'll hand over to you if that's okay.
Yeah, thanks, Steph. So just to run you through, we've got many initiatives at the moment. Just to run through really, and just to start with something that's really key for us on the workforce at Skills for Care. Our workforce strategy for adult social care has been a project that's been off the ground for sort of a year and a half now. We're making good progress. This was actually something that we committed to very independently at Skills for Care in support of the workforce, but we worked together with the adult social care workforce to develop this workforce strategy moving forward to support the sector with the strategy that it needs in order to succeed moving forward. And all of those facts and figures that Steph's already mentioned, ageing population, workforce ageing as well, and so forth. So clearly links there, many aspects of the data touches on why we went around, why we developed this workforce strategy. So the strategy is led by and it's for the actual sector as well. And there's specific areas of key drivers for change that we looked at in relation to this piece of work. We've looked at the shape of care, things like integration, prevention for people's health needs, skills to support people with dementia and mental health and so forth. We also looked at the shape of the current work out there for everybody. As we know, expectations of workforces across the board are different and they're changing. And we also really took time to explore the shape of education as well, how that's evolving and also enhancing and changing, such as the use of technology to deliver great learning, things like those soft skills linking in with ESOL, as Steph has mentioned as well, more micro learning, those bite-sized chunks, and lifelong learning and the impacts on the sector as well. So from the initial work that we carried out over a year with the sector directly involved, there was 3 key strategy themes that emerged from that piece of work, and they were attract and retain, train and transform. And all of those elements include sort of more broken down aspects along the lines of the things that we've already been speaking again. And also alongside each of those 3 strategy themes are a set of clear recommendations and commitments as well. And sort of where are we now? Whilst this workforce strategy is not yet fully adopted or supported by the government, it is being used all the time, and I will often refer to it as a golden thread in all of our work and our advocating for the sector and our influencing as well. This is currently active. Our workforce strategy is still in progress. We've already achieved an awful lot with the workforce, but how we're making this become real is that we're working with a range of people, range of stakeholders, from key system leaders, integrated care boards, for example, local authorities, to help work towards those recommendations and commitments that was set within the 3 main strategy themes. What else we've got working alongside to help make this real and to meet some of those recommendations and commitments as well? We have sort of an oversight executive group of people that are involved. We are promoting where we can that golden thread into ministers' commitments as well for the social care workforce, working with the Care Quality Commission, a Social Work England, and trying to influence against ongoing spending reviews as well. So this is a big piece of what we've done on behalf of the sector this past year and a half at Skills for Care. And I sort of really recommend, if you've not had a chance to look at this, do go on our website, sort of just to have a good read about how this piece of work came together, what's in it, what was identified, and the progress that we're making as we move forward. So just sort of moving on, and I acknowledge I've only got chances today just to sort of touch on bits and pieces that's happening out there and that we're involved in, and there's so much. Here's just a sample of the government's commitment and their investment and current initiatives to support the workforce, to touch on all of those things Steph and I have already mentioned. So I'll first begin with the one in the middle, the care workforce pathway. And quite simply, I'll explain this as the overarching umbrella for the workforce moving forward. There's a lot of investment and commitment into setting the care workforce pathway for adult social care moving forward. And how the care workforce pathway come around was going back years and years, all of those discussions, all of that content that we've heard about there really needing to be a universal career structure for people who work in adult social care. We've not had it. We've not got the NHS system, the bandings and roles and so forth. So yeah, really significant piece of work at this moment in time, and to really help people, support people who think they might be interested in coming to work in the sector, those who are already working in the sector. What does having a career in care really mean? Where can you go? What will take you there? It might be that you're happy in one role, which we know is quite often the case for the workforce. What knowledge, skills and behaviours are really needed to perform well, sort of in that role? So what we've got within the care workforce pathway at the moment, what's already been development, and we have been supporting the government with this. We're commissioned by the government, DHSC, to lead on this piece of work. We've currently got within the care workforce pathway, we've got 8 core different role profiles. So, and this covers role profiles for people who are perhaps just coming in, they're new to care. We've got care worker, we've got an enhanced care worker, personal assistant, supervisor, leader, deputy and registered manager. And this is just a start. These roles are going to evolve and they're going to be added to over the next year or so as well. So within the care workforce pathway, and there's great information on our website and also the DHSC website about this as well. It breaks down each of those individual role profiles, talks about the role, where you're likely to be employed, who you might be providing care and support to, and then it provides a further breakdown of all the required knowledge, skills and behaviours. And also included within that is recommended learning and qualifications as well, which that individual role can undertake to either be really great and competent at what they do, or if they want to move on up the pathway as well. So significant work happening with this at the moment. What's happening at the moment is they're actually refining those original 8 role profiles. So to a degree, still work in progress. They're doing lots of testing with those role profiles, getting feedback from the sector about what's working, what's not working, is the language, is the terminology right, type of thing, and getting feedback as well from people with lived experience who are actually in receipt of care and support. Alongside that, we're also doing a lot of work with the sector about adoption of the care workforce pathway as well. At the moment, it's not a mandatory, but absolutely we're trying to encourage is it's recommended to adopt. And we really acknowledge that each and every care provider out there, it's very different in size, in structure, but it's to give them tools to adopt in the best way for them moving forward as well. But as I think I've already said, lots of great information on our website, lots of opportunities to get involved with this as well. But for yourselves listening into this as learning providers, delivering learning qualifications as well, this is the key strand for you, I think, to get on board with and to understand, because moving forward, this is going to be the basis of other developments that we see for the workforce. So, for example, we've got recommended qualifications linked in to the new to care role profile. And then therefore, and what's happening is that that qualification there becomes funded for specifically for the adult social care sector. So yeah, quite a significant piece of work and lots to sort of keep up to date with against the existing roles, and also how further role profiles they're also being developed as well to carry on. We're also doing a piece of work looking at routeways in and out for regulated professionals as well, occupational therapists, qualified nurses for the workforce and so forth. So that's kind of really key, significant for the workforce, and everything we're going to see stem from that moving forward. But as I said, to a degree, still work in progress. So another piece of key activity, and obviously Steph's mentioned about obviously recognition and pay for the workforce, which we know has been an outstanding issue, and some of those data is quite stark, isn't it? So the government are currently working through a fair pay agreement for adult social care. And I must stress, we're not involved in this at Skills for Care. It's completely being led by the department. And this hopes to provide a new deal for working people, and it's in line with Make Work Pay, which some of you may have heard of. And it's also linked to the legislation from the Employment Rights Bill as well. The aim of the Fair Pay Agreement is for it to set a minimum pay and other terms and conditions for that the employer must meet for those who work in adult social care. So this is what we know has been needed for some time. So where they're at, they've just kind of launched their intention with regards to the Fair Pay Agreement across the sector. Their current stage is at the sort of consultation and engagement stage. So it's very early on at the moment. Quite a big objective here, quite a lot to work through. And the government are sort of working through different policy areas at the moment. The aim is that something could be there available for the workforce by 2027. So that's a couple of years away. But yeah, just started. But I'm not here to promote Skills for Care. But recently we did have a really great webinar that the department presented and we hosted for them. And that's available on our website to learn a bit more about how they're going to go around that, the different components and so forth that they're looking at. And Steph mentioned the new level 2 adult social care certificate, and I apologise now because I can talk about the care certificate for quite a long time. It's been something that's been very close to me since the original care certificate standards were launched well over 10 years ago. So this has been, it still is a key initiative to support the adult social care workforce. Our workforce data tells us that only it's just over 50% of the workforce actually hold a qualification in adult social care, which again, sort of, yeah, can seem quite stark. But we have now in the sector, we have two key care certificate products. One are the original care certificate standards, and they are non-mandatory, just recommended set of induction standards almost to support employers deliver that great robust induction. So not mandatory, it's just there as a resource, but sort of over time, and I'll take us back just to 2022 now, and it was People at the Heart of Care white paper. There was a commitment to support the workforce and carry out aspects of adult social care reform. There was a commitment made to look at those care certificate standards and what would a future delivery model look like. We know, and we still hear now of existing challenges with a set of standards that are not mandatory and are not accredited. Whilst they helped set a great standard, there were lots of challenges. Workers are having to repeat wherever they go the same set of standards. There's lack of trust for portability and so forth. So it was a commitment then to look at the route way forward. And the sector were absolutely committed, and their wish was that the care certificate standards did become accredited via a qualification route, which kind of brings us to where we are today now. So we do have two care certificate products. The standards are just there as a tool for employers if they choose to use them, but then we now have the formal qualification, and the ideal would be that after the employer, the manager has provided induction, they may choose to use the standards to support that. They would then encourage the worker to move on and to gain a baseline level qualification, which gives them recognition for what they do, but also something which is truly portable. So we've had that a year or so now. Still to a degree work in progress, but yeah, that qualification, and I know Steph and the team have that qualification available for you as well. Yeah,
we do.
And that attracts significant funding as well for the workforce under the Learning and Development Scheme.
Yeah, should we just talk a little bit about that? I mean, I know it's quite complex, but I think it's definitely worth just highlighting what is available, you know, in terms of funding. Do you want to just say something about that, Sally?
Yeah, absolutely. Stop me if I'm talking too much, Steph. So we do have a specific funding stream now made available for the adult social care workforce, and that's called the Learning and Development Support Scheme. It did almost to a degree replace something that we did lead on prior at Skills for Care, which was the Workforce Development Fund. But I must just say we no longer have involvement. This is run now by the NHS Business Services Authority under the department. But we obviously have good knowledge. So in a nutshell, there's specific funding available for the adult social care workforce to claim. And that includes a range of different learning programs and also a range of qualifications as well. They're all listed. There are eligible learning and qualifications that can be claimed against. The model is led by the employer. There are eligibility requirements, and an employer must take initiative to lead to get set up on the LDSS system in order to claim funding. And there are some specific requirements, one of them being linking with our workforce data sets as well. But how the model works, so for example, with the level 2 adult social care certificate qualification, that has a really great funding band of 1,540. So what would happen in effect is an employer can put their claim in right away when they've got the learner, the worker signed up to start the qualification. They can actually claim 60% back, and then they claim 40% at the end. So we know that word's still getting out about this scheme for the sector. So as learning providers, you might need to signpost. It might be good if you haven't had chance already just to have a read through of all of the information that's available and how employers can get onto and sort of start to access that fund.
It sounds fantastic, doesn't it? Having money available to you to skill your workforce. Really, yeah, it's there. It probably is an awareness thing, isn't it? Really,
yes, absolutely.
Yeah.
Yeah.
Okay. I mean, thanks for that. So, I mean, that's a really and fairly swift run through everything that a lot of what Skills for Care is doing. But I hope that really illustrates that, you know, there is an awful lot going on here, and there's a real desire, isn't there, I think, in the sector to kind of deal with some of these kind of long-standing issues. So I think there is real hope here that we can move things forward. So in terms of our kind of partnership work and what we've been doing then, based on kind of all the work that Sally and the team are doing, we've kind of thought about a number of things really that we need to look at as an awards organisation when we're thinking about our qualifications. So there's a number of things that we're kind of looking at in terms of underpinning things here are our overall qualification design and assessment innovation. We need to think about whether our assessments are appropriate within certain workplaces. Do they work? How do they work? I mean, we may have requirements sometimes, but, you know, we need to use skilled people to help us understand the sector to make sure that assessments are appropriate to the workplaces that people are going to experience and are realistic for that sector too. Obviously, we're looking at other frameworks where there's been other learning and how we can bring in people's existing knowledge and experience to set against other qualifications or training or whatever. So we're thinking about that. We're looking at ESOL. I think we identified earlier on that one of the issues has been around ESOL within the sector. And one of the things that we're doing as an awarding organisation is looking at our ESOL offer. Should we develop, for example, particular assessments that focus on people potentially working in the health and social care sector so that there is good contextualisation of the English language skills against a realistic workplace setting that people are experiencing? It's their lived experience. So we're looking at that and how we work with our ESOL thing. And also we're looking at how we work in partnership with people. I think as we've become a assessment organisation, the place are building our relationships with employers and training providers is really key to us understanding how we can work together in bigger partnerships to make some of this stuff happen. Okay, so just a very quick run through some of our kind of existing offer. We continue to offer, a range of level 3 access to HE diplomas, a very long-standing, very significant route for people to go into the health and social care sector. As somebody who's worked on access for a significant part of my career, I would always regard these are a fundamental qualification. We've seen, over the years, thousands and thousands of learners go through access diplomas to become workers in the health and social care sector, and across a range of roles too. So they remain a massive part of what we do. Just to flag some other areas as well, is not everything is about big chunky qualifications. We have some smaller things that can be used with people, both who are experienced in the care sector, but also working with people in the care sector. So they can be things like our small, short qualifications, like our awards in health and well-being, developing emotional resilience, developing healthy relationships and respect. They're all small qualifications that, again, I think Sally talked a little bit about induction there and the use of the standards to support that. Some of these small quals can be used to support people's knowledge and understanding of some of these areas too. And then moving onwards, and you could argue upwards, we have another range of, I suppose, higher level, possibly more professionally focused qualifications around a number of areas. So we've got things like for people who are doing assessing and adapting homes so that they understand how they can work in that area of the sector. We've got things around quite other aspects of the care sector around stalking, for example. Importantly, we've got something around palliative care, and we've got one which we developed with Sally's team, the Level 5 Award in Understanding Digital Leadership in Adult Social Care. A brilliant example of where there's been a need identified in the sector and all that information we saw earlier, and then Sally and the team and a group of people worked together to pull together the content of the qualification, which we then as awarding organisations took up and shaped into qualifications and made that available. So, that's a brilliant example of how, work from organisations like Skills for Care can bring things through, working with their employers and other groups. And then we as awarding organisations take that and make that into a usable qualification for people. And then I suppose a slightly left field one, which you might not think is important, but we do have something called equine assisted therapy clinical specialists. We've got an awful lot of people who are working in the care sector who are using equine settings to work with people who need care in a variety of ways. And again, this is about developing qualifications so that those people are skilled in understanding not only the equine aspect of that, they often come with that knowledge, but how they can use the therapy and the clinical aspect of that to help support people using the care sector. So that's just a little flavour of kind of what we have going on. Just the other things I would just add to that as well, I've mentioned about us being an awarding or assessment organisation. Obviously, we now are able to offer foundation apprenticeships, including the health and social care offer. And those are slightly different in terms of the way that we were approved to offer those, in that it does mean that we are approved to offer any apprenticeship that sits within that sector. So if there is any interest in apprenticeships in that area, we're now able to support those as well. So I don't want to go on. I mean, thank you if you've got through this and watched this. Sally, is there anything else you'd like to add or pick up on as we've just quickly moved through that information today?
No, I think that's a good introduction for people. But yeah, do come to our website where we've got a lot more information.
Yeah. Yeah, there's some fantastic resources on the Skills for Care website. Some really useful signposting to resources, materials, what's going on, those various projects that Sally's talked about, as well as links through to some of the qualifications and obviously the funding opportunities as well. But as ever, if there's anything that you've heard about or picked up on there, do just drop us a line and get in touch. We'd be more than happy to help you out and pick up any questions or queries. So thanks for your time today. It's much appreciated.
Thank you.
Thank you.
Thank you, guys. I'll just mention when we put this recording up on our site, we'll make sure that we include links to the relevant websites. And yeah,
Do you want me to send those over to you as well? Because yeah, I know there must
absolutely.
Okay,
probably just reel them off
yeah.
off the top of your head.
Probably. I'll whisk them over to you, Steph. Yeah.
Thank you. That'd be brilliant.